Good evening and welcome to Monday, May 17th, 2021 Board of Health meeting. We have no appointments scheduled. We do have a few action items that we're going to take care of. And the first would be to appoint a Board of Health representative to the Sewer Advisory Board. Now, for the short term, this is something that I'd like to be a part of, but I don't know if anybody else wants to jump in or be a part of that or consider taking the lead. I believe they meet every other week, or is it once a month?
No, it's maybe once a month.
Once a month?
Usually right now it's kind of as needed.
Okay, gotcha.
When an application comes in.
Right. So the Sewer Advisory Board is basically just that. It's to advise the Board of Selectmen and other agencies in town on the direction of the sewer here in East Bridgewater. Thoughts?
I'm okay with that.
What's
Yeah.
that?
So I'll make
Yeah.
a motion to appoint you as the representative to the Sewer Advisory Board.
And I will second it.
Okay, that's a motion, Lisa, and a second, Matt. Any discussion? Hearing none, all in favor?
Aye.
Aye.
Okay. So next we have some disposal work permits, and on the agenda, we're going to remove, I'm going to first remove the ones that we're going, or read the ones that we're going to remove, and then we'll list the ones that we're going to approve, and we'll approve them all at once. So the one that's on the agenda that we're going to remove is 1850 Central Street. That's pending a stormwater application, so that will come back after that application is processed. The next one that we're going to remove is 84 Folsom Ave. That's pending a revision, and once that revision is updated, then we will consider that and put that back on the agenda. So those two items from the agenda are not going to be considered this evening, but we are going to consider and potentially approve a disposal work permit for 1136 Plymouth Street, 84 Bridge Street, I apologize, 36 Sherrill Drive, 35 Hidden Acres, there we go. 40 Water Street, and 48 Old Oak Street. So those that were just read off are we'll consider approving disposal work permits. And do I have a motion on those?
Is 35 Hidden Acres and 40 Water Street, are their revisions still pending, or have they resulted?
Those are the ones that are back.
They are back, okay. I make a motion to approve.
I'll second that.
This motion, Lisa, second, Matt. Any discussion? Hearing none, all in favor?
Aye.
Aye.
Aye. Okay, that passes unanimously. Okay, we have no minutes. We do have some bills for John Delano. And Lisa, do you have those bills in front of you?
I do.
Okay.
You should have them also.
So there was a couple,
Second
so you're gonna
packet.
see in front of you, you also have one for Robert Casper that was just added in. We just got his bill. And so we have a couple added in since the agenda was published. So you have the three that are listed, Delano, B&D, that's for syringe disposal, and Happy Frog, that was for some blood pressure cards for our nurse. But then we also have Robert Casper, who did 22 food inspections this month, so he sent his bill in. And I have a bill to, I don't know if you remember, 2 weeks ago, we voted to release a deed restriction on a property. So I had to chat with the accountants and treasurer's office to find out how we go about paying for that, so they had me do it up as a bill to be paid, and they'll provide us the check to mail in with the deed, with the restriction release, so we have that. And we have a Title V loan bill that, we're gonna not mention the address or name on TV for the applicant's privacy, but you have it in your packet.
So I just have a quick question on the food service inspections. Are these our standard inspections or are these COVID related?
Yep, nope, those are
Those are
our
regular,
biannual,
okay.
yeah, food service inspections.
So are we doing these one at a time, Rob?
Let me just take a quick look here. I want to, so I got, these are all stapled together here. So we have a packet from John Delano.
And he has two bills, yep.
Okay, so we have a packet from John Delano. So these are individuals, correct?
So there was one of them, nope, so it's two bills. One bill, if you look at it, is for, I believe, 6 plan reviews. I think it's $450.
Okay, so these notes in that packet are not bills. This is
Oh,
just,
those are just, yeah, those are reports. for you to
okay,
look at.
those are the reports.
Yep.
Okay. So then, all the bills are stapled together?
The ones that I had ready. for
Okay,
you,
so
yeah.
we have, just as you mentioned, we have Bob Casper.
Yep.
Okay. So these food inspections, I know Lisa just asked a question, these are annual?
Yep, so we do food inspections twice a year.
Okay, so they're biannual?
Yep.
Okay. And now, is this the complete list, or there are
That is
other?
that is just inspections for this month. No, that's not even close to a complete list of all of our food service establishments, yeah.
Okay, so that's $16.50 there. Okay, then an invoice for John. Okay, that was the Hidden Acres. Okay, 36 Cheryl, okay. So that's John's.
Yep, and then what you don't have in front of you is Happy Frog for $55 for blood pressure cards. And Plymouth County Registry of Deeds for $170 for that deed restriction release. And then, actually, where's B&D? B&D Associates for $185 for syringe disposal.
Okay, so. Andy.
So in the last
All right,
couple
so
of
we've
them,
got-
you just voted to pay bills.
Okay, so there's one for John, if I'm reading this right, so there's one for John Delano that's not in this packet. Is that correct?
So John Delano's bill, it's all, it's all, we do it all in one. So it's one bill for John Delano.
Okay, I'm seeing two here.
Yeah, he billed me separately because he did one first and then did the rest afterwards. There's only one invoice. I mean, we have one request for payment to John Delano.
There's two invoices.
Two invoices.
Two invoices, but we're gonna send them one check.
One check. correct.
Okay, okay,
So it looks like there's 5.
I gotcha,
in
5 on
total.
one, okay.
Yep.
So 6 on one and 1 on the other.
Yep.
Okay, all right. So that completes John Delano, right?
Yep.
All right, so B and D we do not have?
Yep, you do. Well, you don't have it in front. So I don't typically make you copies of all the bills, like monthly bills, like the syringes and the office supplies. I've made you copies of John Delano and Rob Casper so you could see what was going on as far as reviews and inspections in the office right now,
Gotcha,
because that's kind of all pertinent to the operation of the office right now.
okay.
So things like B&D and, Happy Frog, those are regular monthly bills, order an office supply, syringe disposal happens every few months, so those are all regular bills. But John Delano and Rob Casper, those are specific to inspections that they did.
Okay. So what was Happy Frogs?
Happy Frog was for $55 for Heather had requested some blood
Okay.
pressure cards for her.
And then B and D?
B&D is syringe disposal, $185.
Now, is that monthly?
We call them, so it's on
As
request.
needed?
So when I get 2 boxes, I call them. So sometimes it's faster than other times, so,
Okay, so that's pretty much as needed.
yep.
There's disposal. Okay. So I'll entertain a motion to pay the bills as listed.
So
So I'll make a motion for Robert Casper, Delano, Happy Frog, the deed restriction, and D&D all to be paid.
Second that.
Okay, that's a motion, Lisa, second, Matt. Any discussions? All in favor?
Aye.
Aye. Okay, now we have a tobacco permit for Viking Liquors. And Lisa, this is, I'm sorry, Sue, this is an annual permit? Okay, so just for my own understanding, so the applicant comes in, fills out the application, or is it online?
Nope, it's out, so we typically mail these out, so they go out every November, December for annual applications. In this particular case, he came in last week and said he couldn't locate his permit.
Gotcha.
So I did as much digging as I could on my end. Unfortunately, during renewal time, I don't know if well, Lisa probably remembers, I was out of the
Yeah,
office
she's
for 3
out.
weeks. So I don't know what happened to his application, but he decided to fill out a new one because he
Okay.
really needs to have it, so.
All right. So so this coming fall, we'll send out
Yep,
renewals to,
usually at the beginning of November, we send out all your food service, tobacco, body art, installers,
okay,
anyone that.
and
has
so
any
that's for the
permit.
coming
So
calendar
you're
year.
you sign a lot, yep, in
Okay.
December and January.
All right,
There was a bit of alternate schedules this past year because of COVID, because we tried to give some of the businesses who had been closed or not operating at full capacity a little bit more time
Sure.
as far as that went.
all right, excellent, thank you. All right, so I'll entertain a motion to approve Viking Liquors tobacco permit.
Motion?
Okay, motion Lisa,
Seconded.
second Matt. Any discussion? Hearing none. All in favor? Aye.
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 It's unanimous. All right. Okay, so that clears up the agenda for action items.
So could we just add one action item that came in today? I put it
Okay,
in your packets. I have a set Title V septic loan, so this will be you and Matt's first Title V septic loan. So we offer a 5% interest rate loan to people that need to repair their septic system when the house is in for sale.
so is that the betterment agreement?
Yep, so typically, up until now, we've never been on television, so, I would probably just ask that we don't, talk about the
Sure.
person's name or address, obviously, but that is the agreement that the homeowners have already signed, and that the board needs to sign, and then the lien gets recorded at the registry of deeds until the septic betterment is paid off. There should be, you'll have two things to sign at the end of the meeting. One is the actual loan agreement, and one is the lien. And I
Now,
will
I know we're
expect
not
you to have
gonna, I know we're not gonna, so I see the owners' names here.
Yep,
Do we have their address?
yep, it should be in the first, it should be in the,
Front page.
if you look at the packet in the first paragraph, it should list the address.
There it is. Okay, fantastic. Okay,
And you'll be seeing some more of these. We have a lot of failed septic systems. We have a lot of people.
okay,
that
so
have
this is,
applied to
we don't vote on that, right? We
Yeah,
just-
you do, yep.
we do vote on it.
to approve it, yep. You're just gonna say, you just, as noted in the packet or something without saying the name and
Yep.
address, that's all.
Has everyone had a chance to look it over?
Yes, I'm all
So
set.
I would make a motion to approve the betterment agreement for the property listed in the packet.
Second that motion.
Okay, so we got a motion, Lisa, second Matt. Any discussion? Hearing none. All in favor?
Aye.
Aye.
Aye. Passes unanimously. Okay. So Sue, does that cover us off for action items?
It does.
Awesome. Okay, so Barker and Sons memorandum. Okay, so I was gonna talk about that. All right, so for discussion, we have, it's been very fast-paced changes the last couple of weeks for COVID guidance and case updates. So Sue, can you bring us up to speed there?
So the good news is, as of last check today, we had 21 cases confirmed and probable over the last 2 weeks. That's down from last Monday at this time to 36, so that's the good news. And as far as the guidance goes, I'm sure everyone's probably shared it all over social media by now where, the governor was on today. We had a webinar about 10:30 this morning. And, the CDC studies have shown that vaccinated people have very good protection. They're highly unlikely to shed the virus and pass it on to somebody else. And so for that reason, effective May 29th, they're lifting the current face covering order and lifting all COVID restrictions, with the exception of you'll still need to wear a face covering in all public transportation, like airplanes, trains, buses, even Uber or Lyft, in congregate care settings, sorry, Lisa, and prisons. K through 12 students and teachers will still have to continue to wear masks indoors. I'm sure the reasoning for that is they're not all able to have the vaccine offered to them yet. So those are the big things. The other big thing is effective tomorrow. Youth sports under 18, outdoor sports no longer require a face covering. And like daycares, up to this point, haven't been able to share toys or anything. They can go ahead and start sharing toys. And kids at recess no longer need to wear face coverings. So those are the things that go into effect immediately tomorrow. So I did have them do a press release today, just try to get the word out. I know there's a lot of different sports teams in town. I am totally out of the loop of who's in charge of what team anymore because my kids are older, but
Sure.
I'm sure I know you're involved in some
Yeah.
and you're involved in some, so I'm sure you'll get the word out. But that's all effective immediately, so.
Now, the press release, are they still working on that?
Nope, it went out.
It went out.
Today, so it's on our website, it's on Facebook. So if you go on and look, you can share it, like if you go to the East Bridgewater website or the page, it's on there. And he's got links to all the new guidance documents for people to look at. It kind of spells out all the changes.
So-
So,
Go
oh,
ahead,
I'm
Lisa.
sorry. So just to clarify, with the mask mandate being lifted in other businesses, I assume they still have the option if they want to enforce it, and if that is the case, is that still covered under our guidelines where we're following the state and they're more or less would shift to a personal business guideline?
So they're gonna come out on May 29th with what they're gonna call face covering guidance, which is gonna talk about what the guidance should be for unvaccinated individuals. It's not going to be anything that comes with a fine or enforcement on the state end. Towns and businesses can adopt their own, businesses is private property, so any business can say.
Well, that's
you
what I
can't
mean, like, I'm
yeah.
assuming, say, for example, business X decided, well, we're gonna still require civilians to wear a mask when in our premise. Because that's their business
They have the right
guideline,
to
it
do
wouldn't
that.
be covered under our
No, we wouldn't
jurisdiction
enforce
anymore,
that, right,
yes.
so that would be right to the business. There has been some talk, I know there's some concern about, if the town wants to adopt any policies for town office buildings. So that's something we'd probably have to discuss with the Board of Selectmen, because they, we enforce all the guides that the state puts out, but they would create policy for town buildings. The library has already reached out looking for guidance, so I told them I'd see what I can find for them, but right now, I don't know if the library falls under the Board of Selectmen or if they are an autonomous board. Does anybody know the answer to that?
I'm not sure.
They have a lot of questions, so I said, well, I'll see what I can find for you. But the way I understood it today is that as far as the state is concerned, it's gonna be just strictly guidance, telling people if you're not vaccinated, you need to be careful, you should wear a mask.
Right.
Except for places like nursing homes or
Yeah.
prisons or.
My direction with that question is, when it's lifted entirely, would we post something on our page basically reaffirming that the state has stated no more masks are required, and if there's an individual business occurrence that it would not come to, just so I don't want you to get
Right.
inundated
Well,
with
it-
calls in the office like, oh, well, we were here
Right.
and they said we had to, or we saw, you know what I mean? Because it would
Right.
kind of be off our
It would fall
chart
on
at
the
that
business,
point.
Right, exactly, yeah. It would not be enforceable by us if the business did. And I know CVS has already come out and said they're going to keep masks. Some businesses have already come out. Walmart says they're not. So, every business is gonna do their own thing, and that's their purview.
Mhm.
So really, the only thing we're gonna have any control over would be town buildings.
Yeah.
In the schools, the K through 12 and teachers that, they'll be under DESI guidance, so.
I just think just to offset the load in the office, it might be good when,
Yeah, oh,
when it's
believe
done,
me,
to post it
I-
and just be like, going forward,
Yeah,
the,
yeah,
you know
we
what I mean,
won't.
what we do not
When it's-
cover.
Yeah, when it's not a mandate, then it's not gonna be enforceable by us.
Yeah.
Because we cannot ask for vaccination records. But businesses can require their employees to be vaccinated, they can,
Right.
require information, so it's gonna get a little confusing for a while, and I was saying to Matt earlier, I think my biggest thing is, and I'm sure you guys all feel the same way, just everyone needs to respect each other's feelings.
Right.
And if you wanna continue to wear a mask, vaccinated or not, that's your prerogative, and, I think everyone just has to have respect for the virus and respect for each other, we're, we're a community, so I just don't wanna see this tear anybody apart, so that's
No,
one of my
good
biggest
point.
things.
But to Lisa's point, anything that we can do to, answer the questions up front
Yeah.
with the self-service opposed to just your fault.
Oh, yeah, no, we definitely will. I think we need to talk first, we need to find out first where the selectmen are headed as far as if there's gonna be any kind of town building policy and kind of do it all at once.
Right.
One and done. So have you noticed an increase in calls today?
I had a huge increase in calls on, what day did the CDC come out, Thursday?
Last week, yeah.
Emails
Thursday
and
night.
phone calls galore from all my businesses saying, okay, so we don't have to wear masks anymore? I'm like, yes, yeah, it's not, yes, you do. So Thursday was the big thing. I put something out on social media and the website Thursday saying there's still a state mandate, CDC guidance is guidance, but we still
Right,
have a
right.
mandate, so. That was the biggest call volume, was
Gotcha.
Thursday. I really haven't heard much today. A few, the Y called, the library called, so a few businesses with questions.
Now, did our volunteer start?
Yep, Nancy.
Yep.
She came in last Tuesday and Thursday. She's
Okay.
wonderful.
Great.
So she'll be back again tomorrow.
Okay.
Yeah.
So, big help?
Yep, she's a big
Excellent,
help.
okay,
Yep,
that's-
she's
that's
very fluent on the
huge
computer
concern.
and did some filing and,
Great.
yep, lovely.
Okay.
Awesome.
And I guess while we're talking about the COVID guidance and the case update, I've seen it on some pictures on social media, and it looks like everybody had a great time this weekend at prom.
All reports say it was a success.
Okay.
We got a mom here.
Yeah, it was great.
Okay. I know it wasn't, we're at the tail end of all of this, but, some prom was better than no prom.
Yeah, I
And-
think, it was outside, there was a little bit of conflict regarding guidelines that were in place and guidelines where the state sat, but the kids were very respectful, they kept their masks on. When they did do their pictures, they took them down quick, put them back on, so, I think the seniors more or less were very respectful because they didn't want to impact the junior prom the next day, and then the juniors in turn were very respectful because now they're looking at graduation, so.
Right, great, that's excellent. So I want to recognize you and thank you, Sue, for your work with Karen and the schools and making sure that the kids, had a
The pictures
successful
look
and
great. I don't know,
safe
everyone's
event,
moms,
so-
I've been watching everyone's photos, so I was,
Yeah, yeah.
Of course, if they had waited a few more weeks, they might not have had to wear their masks outside, but
Yeah, just
who knew
don't
this
know.
was coming,
Nobody
and,
knows. So-
I was just happy they had it, but,
So now we just need to look forward to a safe graduation.
yeah.
All right, excellent. Thanks again for that, Sue. So vaccination updates, clinic planning.
Did you guys get my email this afternoon?
Yes.
Did.
Okay. Maybe. I know, it's
Yes, but
busy, it's
haven't
been a
had a
busy
chance-
day,
yeah.
I
Yeah.
know. So we have, scheduled, we got very lucky, we have a collaboration with Bridgewater State University. We kind of joined forces with them, trying to get them to be a community collaborative.
Mhm.
And they reached out to towns and said, if you want vaccine, let us know. So we scheduled a clinic with Pfizer for this Thursday at the school. The school did a survey, and they were shocked at the amount of feedback they got. They thought they'd get, under 50, they got 150.
Can I just back you up for
Yeah.
1 second? Okay, so when you say at the school, are we talking here or at BSU?
Here.
Here at the high
Right
school?
here, yep.
Okay, great.
So it's by appointment, I should say that out loud. So the school has been given the link to schedule appointments that they are emailing to all parents.
It went
Did
out,
you get
I already
Okay.
got it, yeah.
They're emailing it to all parents, so that's by appointment, and we had them just write a little something saying, don't forward this link. If we have extra appointments, then we'll expand the offering, because I do have, I ordered more than people signed up for, because you had to order it in denominations. It is Pfizer, so 12 to 18-year-olds can get it. So we did a targeted 12 to 18-year-old clinic. I have Heather Doucette is going to be, my lead on that. She's our nurse. And then I have a nurse from the central school that's available, possibly 2 nurses from the high school, and 3 employees from the fire department.
Okay,
So,
excellent.
it sounds like,
Are you one of them?
I will be there as a member of the Board of Health.
Gotcha, okay, perfect. So 12 and 13-year-olds, they're still, at that age is still at the middle school, correct?
yeah, but the clinic will be, so we're going to run it,
No, they're
Are
not.
they
They're at
here?
the high school.
12 is at 7th grade?
Ben just turned 14 and he's 8th grade. So I think there's some 12, depending on their birth date, there are some 12s at the high school.
Okay, but there's definitely 12s at the middle school.
There
Yeah.
could be some.
so the.
So I guess my question was, is it parents bringing them, or how,
Yeah.
or are we going to?
Nope, so we scheduled it for like 2:30 to 6:30 to give those people that, need
Gotcha.
to come after work.
Okay.
But also we didn't want to do it too later on the weekend so that we could actually get paramedics to.
So it's purely after school?
And I believe, because it came from the high school, from Karen Clifford, it's for that I don't think it went out to the middle school or the.
No, it should have gone to any.
I got it.
You did get it?
I got it, and I only have a middle school.
Yeah.
Okay.
Yeah, I think, because she's the COVID thing for the whole school, for the whole system, so
System.
she was able to go in and identify anyone that had 12-year-old to 18-year-old.
Yeah, perfect.
So hopefully, I mean, it'll be, we have plans in place, like we did our flu clinics at the old high school, so we have like a full plan in place, so hopefully we can carry that over to,
Now, do we know how many doses we're getting?
so I have 200 doses.
And then as far as the second dose, will they then subsequently in 3 weeks give you 200
Yep.
for the same?
You're
group?
guaranteed your second. Yep.
Okay.
Yep, so.
Sue, is this open to students that do not go to East Bridgewater Public Schools?
That's a good question.
So, that is a very good question. So we wouldn't have that information, but if they live in East Bridgewater and they're a student, I'll see if I can find a way to, they'd have to probably call the office for me to schedule an appointment, because I don't want to put it out as a public clinic, to make sure
Right.
that the students that want it have the opportunity, because it is Pfizer and we want to give
Would the
them.
administration have a list of families that are?
They might have a list, they might just not have contact information, so we can get
We
the
should at
word
least
out
ask the
somehow.
Do you
question
mean
if you don't have-
as far as school choice, or do you mean like homeschool?
Like
Both.
Southeastern.
Homeschool, school choice, private schools.
I know
a-
school
any of
choice
those-
they would, as homeschool and like going to a different, I don't know, because I know when there's school choice, there's a portion of funding that actually comes from the town, but the other 2 alternatives, I think once the initial transfer out of the system is done, I don't think they keep track to follow them.
Gotcha.
But I would assume that those kids would be covered under the schools that they are going, if those schools then got a vaccine. But I know that Shaw's and Hanson also has, like, I've seen them pop up.
Oh, yeah, you can,
They're
I mean,
kind of-
Bridgewater- you can go to
yeah.
Bridgewater State University right now. It's more about the convenience, and we figured the comfort level for parents to come to their own community with their own, firefighters and nurses, maybe it's a little bit of a comfort thing.
So what's the tie-in with BSU? Are they going to be sending volunteers?
Nope, so we do it, as part of the collaborative effort to support BSU as a regional vaccination site, we were told as local boards of health that any excess vaccine, if we requested some, we could get it. So about 2 weeks ago, we
Okay,
got that email,
okay.
so.
So we're piggybacking on their
Yep, so
excess.
the director for BSU dropped off the vaccine today. It's locked safe and sound in the office. And, the trick is, and it was like a last minute scheduling thing, is you have to use it within so many days.
Right.
So, it was a time thing.
Okay.
So,
And is the
Excellent.
date that, I don't want to say the date on TV yet, just in case it's not, but the date that we discussed, the second date,
June
that's
10th,
their
yes.
second dose date?
yep, so basically
So-
after this appointment, I'll have to make another clinic and send out the link again to schedule the second appointment.
So do they have to commit? Like, I know, having done this a few different times, we ran into issues where they got their first dose and then they weren't able to come for their second dose to where I was giving it.
Yep.
And that kind of threw it off, because then in order to give someone else that dose as a first dose, you have to have a third clinic. So if they're committing, is it like a 2-step process, like you're going to come on this day and then you have to commit to return for your second dose?
We don't have it set up that way,
Okay.
mostly probably because it's probably gonna be tough to try to do that as a town clinic, not like, we're not set up like a CVS or something. But we can, it only takes 35 minutes to defrost, so we can keep some frozen.
Okay.
And we can give it back to.
I didn't know if
BSU.
it was going to be like, say,
No.
this day and this day, and
So
you
we have
sign
the
up for
date
the
already
two.
planned for June 10th.
Yep.
But I don't think there'll be clinics beyond that, because now
Okay.
we're talking about the last week of school, I think, is that week.
The 20, seniors are done this week, and then I think the
Yeah.
rest is the 20th.
And then you've got everyone on vacation, and so we're trying to kind of get it wrapped up with just, it's a one.
I didn't want to make it more complicated. I
Yeah.
just knew it came into issue because when you gave someone the dose, they had 3 weeks, and then
Yeah.
if they missed their second appointment and they tried to go elsewhere, it was hard for them to get in before their first dose was negated, and then they
Yeah.
had to start all
I
over
think
again.
it's easier now, because I know, like, my mother, for instance, she missed her second dose, and I was able to find her one at CVS, no problem. So I think it's a little easier now that it's so readily available.
Yeah.
So it's good news.
Okay. All right, so, so right now, Sue has done a great job on, going on a seek and find mission for folks that can help us out with a couple of things that, the health agent would handle until we get that position posted and filled. So, we have, is it Bucher, is that how it's pronounced?
Yep.
Okay, so Bucher and Sons, to fill in and handle some of those stop gaps that normally the health agent would. So do you want to bring us up to speed a little bit, Sue, on?
I think did I give you all a copy of the contract?
Yep.
So, Mr. Bucher had been formerly a health agent in Taunton and Middleborough, and he opened his own, left the government and opened his own business doing Title V services. He works for municipalities, he works for himself, so he's currently doing plan reviews for the town of Halifax and inspections and plan reviews for the town of Mattapoisett. So it's basically, he bills us once a month on whatever services we request of him, and he kind of gave us a price point layout. He's doing his first perk test in town tomorrow, and he's gonna stop by the office and pick up his first plan to review. So you'll kind of have a better idea, when you see his reviews and, what your feelings are.
Can you send us all the price list?
Is it not?
It's down on the
Under
bottom.
compensation on the front page. Bottom bullet.
And how, are those pretty much comparable to the previous?
Gotcha.
So with the previous, we were paying a salary, so you can't really compare.
Oh, so you can't really-
Yeah,
okay.
yeah. But it's comparable to other review engineers in the area. And I've talked, I did call for a few references on him, and a few of our local engineers have worked with him in the past, and they all find him professional and easy to work with, so we shall see. So right now, he's kind of set up so that he's given me Tuesdays and Thursdays to schedule a perk test, as, those are two definite, so if I get a perk test application, I know I can schedule him for a Tuesday or Thursday.
Perfect.
And then after that, we're kind of adding time as we need it, but it's, so far it's been manageable.
Okay. Anybody have any questions?
No.
Okay, so this has gone through the town administrator, the interim town administrator, Jim Purcell, so we've got Mr. Bucher and Sons on board. And does he go by Rob, Robert, Bob?
Bob.
Is that an industry name? Is it just seems like there's a lot of Robs or Bobs or Robert,
No, there is.
right? There seems
Very
to be
common
a.
name. I'm
We
married.
got,
so
we
I
got
don't
Bob
know.
Casper, we
Yeah.
had, so, all right.
It's easy for me.
Seems to be it. Okay, well, yeah, sure. Okay. Let's see, so that's gonna segue into, Environmental Partners Engineering Services. We've had, John, and Peter come in and tell us a little bit about the program and what Environmental Protection Services is gonna be an umbrella engineering firm for the town and for all the boards, with kind of the exception of Board of Health. So we'll have some, when there's like a joint or a co-approval process, like with Conservation Commission and Board of Health, that would segue over to environmental protection engineers.
Yeah. Or like a big industrial type project, something
Correct.
like it's not your typical septic
Right,
repair.
exactly, yep. So what, I'm not gonna rehash fully what John and Peter said, but it's just an umbrella engineering firm that will be able to take applicants for a number of different projects from beginning to end, and hopefully expedite and streamline that process without missing any steps. So there is a meeting Wednesday morning at 9 a.m. So if anybody wants to attend, you're more than welcome to. I plan on being there, and just to kind of get a closer view as to what they're all about and what they can offer. Sue did reach out to them early on for some plan reviews, and it came back substantially higher than what we were paying with Berg and Sons. So we won't be utilizing them as often as some of the other boards will be. But it's 9 a.m. I'm assuming it's going to be right here with the Board of Selectmen, and anybody's welcome to attend. I plan on being here. If you can make it, that's great. If not, we'll keep you up to date on the outcome of the meeting.
I think you just have to let me know, because if we have a quorum, I have to post a meeting for the Board of Health, so you have to just let me know what your plans are if you want to attend.
And
Okay.
just to clarify, when you say everyone's welcome, you mean
Just the
everyone
board members,
here,
yeah.
not
Right,
right,
public?
right.
I
Yeah,
just,
yeah.
yeah.
Oh, that's a good point. Thank you for that. Let's see, moving right along here. Okay, Bridge Street landfill. So,
I put a letter in your packet
Yep,
from
got it.
Tim, so I know, Lisa, I can't remember if Tim came in before or after you started about the burn building.
I was I was there for that meeting, and then I know it got put on hold. I actually read something online about this, and I knew it rang a bell,
Okay.
but I kind of declined any input because I didn't quite remember.
So the reason I
all the
put it on was
particulars.
because we'd been getting some calls about a proposed target range for the police department down there. That had been raising a lot of eyebrows because I wasn't aware of it. And I guess it had been something that had been discussed with the previous police chief and, and different employees, because it's not right next to the active landfill area, even though it's, our jurisdiction. But since preparing this agenda, the police department has actually found an alternative site, I believe in Brockton, that they're going to have, use the range there, because they only need it a few times a year for qualifying and training. So, for anyone listening, right, currently the target range is no longer a proposal at the landfill, but the burn building still is. That's something the previous Board of Health approved. We went to DEP about it, we got approval from them. So I think Chief Harum just recently had like a public Zoom forum or meeting about it for
Makes sense.
abutters. I think maybe only one abutter attended though, but he's been doing a lot of outreach in the neighborhood about it. So he's it's back on the table now because COVID is kind of quieting down. So I just wanted to make sure that the new board knew that there was not going to be a target range. However, there is still going to be a burn building.
okay, so, and again, I apologize, I haven't read through this whole letter here, but, so they did have a Zoom meeting on 5/6.
They had a Zoom meeting for the, for the abutters.
Okay,
Yep. And I think he even went door to door to a few neighbors to talk to them about some concerns. So he's gone through the process thoroughly, from start
Yeah, I
to
think
finish.
there was, I want to say it was the end of April, there were some abutters that were posting on the East Bridgewater politics page that they weren't notified, and it almost seemed like they got the impression that it was already underway, like it was going to start at any.
Oh.
So
Yeah,
then it was,
yep.
so is there a time frame for this training?
I think he's waiting, so, it's the Fire Chiefs Association, or is that?
The Plymouth County Training Association.
Yeah, so I think this was the next step in the process, was to have the public forum.
Gotcha.
and
Well, it is
then-
the Fire Chiefs Association.
Yeah,
I'm
and
sorry.
so once they finish with that,
Many
then the board of the next step. So I would, knowing Chief Harum, he'll let us know when construction, it's not really construction, it's an actual like literal box.
So this would be an ongoing training
This
facility?
would
for-
be a building, the dimensions are there, about 40 feet wide, about 42 feet tall, that would involve different rooms for different utilization.
Okay.
One room would be live fire training that would be used sporadically. It's not an everyday thing. And in that room, we burn hay, occasionally pellets, so the smoke condition is very, very minimal for outside of the building. It's not a nuisance smoke. This is the sort of thing that they do very frequently in the fire academy. It's not something that we haven't experienced before, and so it's
So would this be
pretty
just for
standard.
East Bridgewater firefighters? or-
No, this would be for, I believe the plan is we will be able to use it because it'd be in our community, but it'd also be extended to Plymouth County Training Association.
Okay.
And I believe also the Plymouth County Tech Rescue Team will be using it as well.
So, let's just say the invitation goes out to the Plymouth County area and things like that, who's the point of contact for scheduling and things like that? Is
That is beyond me. That's a question we can absolutely bring to the fire chief.
Okay. Do we know that? Like how scheduling and,
Yep, I mean, we could certainly have them come, since it's a whole new board now, we
Yep.
can certainly have them come into like our next meeting just to kind of brush you guys up on what the process
well,
is
was
gonna
that
be.
part of a presentation once before that we could?
He came
focus
in,
on?
no, it wasn't, well, our meetings were not televised previously, so he just came into a meeting to ask permission, and that was really
Okay,
much.
you guys think that'd be a worthwhile visit from the chief or? I mean, I'd like to know a little bit more about it, just so that we can find out, the overall scope and
Yep,
frequency and things like that. Okay.
can do that. I mean, while we're on the subject, real quick, I just got a message, gotta love technology. Miss Gilpatrick must be watching our meeting. She just texted me to let me know that it is too late to post a meeting for Wednesday morning, so I cannot have a quorum at the meeting Wednesday, so we'll have to designate someone
Okay.
from the board to come. So you can just decide on that.
Thank you, Sue. And Sue.
Sue and Sue. She's good.
Okay, so we got the landfill squared off. Office staff and operations, so right now, we've kind of talked a little bit about that with the volunteer that's coming in 2 days a week to give Sue a hand. We have Bob on board, and also continue to utilize Bob Casper, who's the health agent from West Bridgewater, is that correct?
Yep.
Okay. So, Camp Setauket permit and inspection,
So we got the Kansatucket application in.
okay?
So I did, I can't remember if it was you or Matt or somebody had asked me about inspecting the camp.
Yeah.
So I reached out to Rob Casper.
Mhm.
He's a certified pool operator, just to have him walk me through the process for, camps. He inspects the YMCA camp in another town. So he said typically what he would do, and he'd be willing to do it for us as a pool, as a pool operator. He would go out and do the pool inspection for both pools, because they use the pools as part of the camp,
Mhm.
prior to camp opening. And then as long as they had their medical directors licensed and their lifeguards licensed and all that, they could get a permit to open the camp, because he would prefer to inspect it while the camp is in operation.
Gotcha.
So you can actually see what's happening there.
So the pool would be prior? and
Yeah, because
then-
they would do a bacteria, he said they would take a bacteria sample of the water, and so he would schedule that ahead of time, get a bacteria sample, make sure all their operator stuff was in order. And then when camp started, he would go out while it was in session,
Gotcha,
and he is willing to do that for us.
okay.
Camp Setauket is YMCA
Yeah,
camp, right?
yep.
Okay.
Yep, and today, actually, we got an email today, I haven't even had a chance to peruse it yet, but they're, obviously with all the COVID changes, all the camp guidance has changed like 3 times in the last
Yeah.
month, so, same thing, as everybody else, the kids outdoors will not need masks at camp anymore. If they have to be indoors, then they need a mask, so if it's gonna be a rainy day, they probably have to pack a mask, but outdoors, they won't need one.
Okay. Okay, upcoming event on the Common Community Coalition for Change. How does that,
So I put that on prior to today's announcement. So that was to talk about, if you're comfortable with all the COVID guidance and can it meet it, because it was an event or a festival, depending on how you looked at it. And they needed all the boards to sign off on it.
okay,
And that would be also, so that goes through every board here. So we'll still have to sign off on it because they want to have food service. And they haven't nailed down all the food trucks that are going to be there, but we've gotten an application from one vendor so far. But this event is going to be after May 29th, so the COVID guidance, it's an outdoor event, so there'll be no COVID guidance.
Yeah.
It will just be about making sure the food trucks are ones that have already been permitted and inspected, and if they have been, then they have to get a license and an inspection. So that, the reason for it to be on the agenda was really to talk about, could it comply with COVID? And
so what's the date of that?
I believe it's
The
June.
7th? June 7th? I have it somewhere. It's like 4 to 7, I know they did put up a sign-up genius type thing, because that was a question of, as far as how would they
Contact
keep
tracing.
record of people.
Yeah.
So is this,
I believe it's a
Through the
racial.
schools, or-
It's a
No, it's a
they're calling it
private,
a
yeah.
multicultural event, so it's, well, the schools are somewhat involved, so, Nadia Clancy is the event organizer, she's a resident here in town, but, I've been dealing with, Mrs. Sheehan, who I think is a history teacher
Okay.
at the high
Yep,
school.
yep.
And she has her foreign language students and another group of another club that she's involved with, working at, the event, and they're gonna be doing some fundraising and selling T-shirts, and if there was COVID guidance, they were gonna be helping to make sure, there was social distancing and this and that, so.
So it's listed as a celebration of multiculturalism by the Community Coalition for Change, which I believe Nadia is the head of.
Yep.
The date is Sunday, June 13th, from 4 to 7 on the town common.
Gotcha.
Yeah.
Thank you for that, Lisa.
And there's an Eventbrite sign up. I know it went out to the 8th grade class. I'm sure it's probably posted on other Facebook groups, but that's where I received it. There's a raffle. They'll be selling apparel, lawn signs. They don't have anything in here listed. They are posting a liability waiver, but as far as the food trucks, they don't have anything
No.
posted for that just yet.
I know they were trying to find food trucks, of different, to kind of
That's what you-
span the multicultural
Yep, yep.
theme, so, I do have someone, that's a caterer from Brockton, and I want to say she's maybe going to make some ribs, but I can't, off the top of my head, I can't remember, but she has all her licenses in order already, so she's the only vendor I've spoken to in person so far, but Mrs. Sheehan is aware that, I've given her a list of all of our approved food trucks that we have already, and I explained to her what ones that aren't licensed need to do to get licensed. And she's been, really communicative, and she's kind of got the charge on the food service part of it, so I think it will be fine.
So, when you say we need to sign off on that, is it something that, there's a permit that we need to vote on, or is that?
Nope, it's, so it's kind of like a building permit sign off, but it's a new application the selectmen came up with to make sure that, so that every department knows, so the police know if they need a detail, or the fire department knows if there's gonna be an issue with fire, so it comes to us to, so we would, I would put in the notes, food trucks need to be licensed. If there was COVID guidance, we would have to know if they could comply with it. So that was the main reason for having them on the agenda tonight.
Previously to the new guideline update, I think it would have just been, our involvement would have been food trucks.
Right.
But then subsequently, prior to the
Yeah.
guidelines opening up, it would have been similar to other events in town, like how are they gonna do crowd control, how are they gonna do contract tracing, like to keep track where it's a common area and they
Sure.
can come and go. But that's kind of all been negated now
Yeah.
that the lifting of the guidelines.
All right, very good. Okay. Topics not reasonably anticipated by chair 48 hours in advance.
So I'm putting that on now, from now on, as a regular item, because
Okay.
as you can tell, I have to have the agenda posted by Thursday. And like, for instance, today's guidance, like a lot can happen, so I mean, I always keep the guidance on there now because we're in COVID times, but, so that's on the selectmen's agenda too, so that's in case you've got, you got a call over the weekend, or one of you got a call about a concern about something that you can bring it to the table if you didn't anticipate it, if it's something that shouldn't wait 2 weeks.
Okay.
But the one thing I did want to bring up under that umbrella is that the meeting schedule. So because of Memorial Day, we have kind of a 3-week span.
Right.
And I got a lot of septic systems that are coming in that have closing dates. And yes, I know, that's really not our emergency, but also, I hate to see some new homeowner lose out on a sale because our meeting didn't go for 3 weeks. So, I tossed around the idea of having a meeting in between before Memorial Day, or we could have a meeting that necessarily didn't even actually have to be televised. It could specifically be a quick meeting to sign septic plans, and that would be the only thing. So just a couple ideas I wanted to toss around, but I know off the top of my head of at least 3 pending sales that they're still waiting for their septic designs to come in and get approved, and they're panicking at looking at the calendar when our next meeting might be.
So what's the,
So we have to post 48 hours in advance. So it could be one of those things where we don't have to decide the second, we can wait to see what we get in, or we could just pick a date now.
so, okay, well, that's one thing I wanted to have us all chat about for a second here. So looking at the calendar, what would be, would you say we have 3? that have upcoming closings?
At least 3, but I mean, that's, tomorrow could be 3 more. So they come in, they come in regularly. So there was a lot of perk tests that have been done in the last few weeks that I'm expecting plans on. But I know of 3.
So our technical would be 1st and 3rd of the month, which would be June 7th and June 21st.
Right, because we're in a 5-week month right now, I think it gives us an extra week. So previously to this, the permits were sometimes approved in between meetings, but that is because we have a new review engineer, that's not how it's working right now, so I just want to make
So
sure.
what would be what would be an optimal date so that we can capture the most amount of,
Like, are you thinking the week of the 24th, or are you
So that's next
thinking
week, right?
maybe
Well, obviously not the holiday.
Tuesday the 1st? If everyone
I
is
mean, I would
avail-
say if we could do something next week, that would probably be, ideal. It doesn't have to, it could be a Monday, it doesn't have to be a Monday.
yeah, I'll make it work. I mean, we want to make sure that we don't hold up any closings or put anybody's home purchase at risk.
Right.
So, but, obviously folks have travel plans and things like that, so, like the 27th is a Thursday, 28th Friday. Now, I know we're only open in the morning, but,
Yep.
so I'm not opposed to either one of those dates if,
I can do either one of those. If the Friday was a morning, that would be fine. But do you need a day to see what you have coming up, or?
So, well, I know, like I say, I know I'll definitely have some in by then. So, I mean, and at that point, the next meeting's only gonna be another, week and a half out anyway. So, if doing right smack in the middle at the end of next week would probably be good, because that'd be right in the middle of 3 weeks.
Are you available on a Friday
I can
morning
be
then?
available, definitely available on the 27th, and again, like you, as long as it's in the morning on the
Yep.
28th, for like first thing, I can be here.
okay, so if I'm hearing everybody, the morning of the 28th?
Okay.
That
So, and
works.
I think I just want to reassure the public too, because that'll just probably be a brief meeting, and I will only put on the agenda septic approvals.
Sure.
All right, so we won't discuss any
Yep, yep.
pertinent. just
So we won't
people-
televise, we'll just meet up in the office?
Yeah,
you
we'll
think?
just,
just kinda
to me,
low-
that makes the most sense, because, like I said, I won't put anything on the agenda other than septic
Just
approvals,
septics.
and I'll put on the agenda the addresses that we're approving, so that people know
Okay.
what exactly is happening.
Perfect.
What time are we thinking?
What do you think?
8:30, 9? What time do you come in?
8:30.
Is that too soon? Do you want to wait for 9?
No, I can get ready, I can get ready the night
The night
before.
before? Does that work for everybody?
8:30 works.
Works for me.
All right, so I'll post that.
Guys, thanks for making that adjustment. That's,
And then we'll be back on to our 1st and 3rd, but this is a kind of a busy time of year for septic systems.
okay, so that's that.
I think that is all I have on my very lengthy list.
So, before we close, just remember, we're gonna have some things to sign, so when the bell goes off, and I know it's a nice night up there, we got some homework to do.
Don't run.
Does anybody else have anything?
Nope.
Okay, I'll entertain a motion to close out the meeting.
Motion?
Second.
Motion Lisa, second Matt. Any discussions? Hearing none, all in favor?
Aye.
Aye.
Aye, that's unanimous. And that closes the Board of Health meeting for Monday, May 17th, 2021. Thank you, everybody.
That was our longest meeting in a while.